5 prescription medications I hate as a pharmacist. Number 1, diclofenac. It is not any better at its job as an NSAID as something like naproxen or ibuprofen, but it's going to put you at a higher risk for cardiac events. Some doctors prescribe diclofenac rather than other NSAIDs, believing that it's better for the stomach, but it is not. The data does not bear this out. It's not any better for your stomach, and it puts you at higher risk for cardiac issues. Naproxen is a much better choice. Number 2 is simvastatin. It's the worst of all the statins. It puts you at higher risk for muscle pain, and it doesn't even work as well as the other ones anyway. A much better choice would be atorvastatin or rosuvastatin. Number 3 is zolpidem or Ambien. Super habit forming, associated with terrible long-term outcomes for patients. It's going to keep you in these superficial stages of sleep up here, not allow you to get the truly restful sleep that will help your brain. Not safe for long-term use. A much better choice would be over-the-counter options like melatonin, 5-HTP, and magnesium. Number 4 is gabapentin. We see wildly escalating doses as the years go on without much benefit for the patient, once again associated with terrible, terrible long-term outcomes. The tiny benefit that gabapentin may provide is not worth the risk for most people. Try something that will calm the inflammation in your body like omega-3s and turmeric instead. Number 5 is benzodiazepines. Guys, these are so incredibly habit forming. They are so bad for your brain chemistry, associated with terrible long-term outcomes like dementia. Instead of relying on benzodiazepines, try cognitive behavioral therapy. Try learning these skills to replace the pills, as my buddy and psychologist Dr. Scott Sims always says. Using these chemicals that affect your brain chemistry long-term is just not a good idea. Follow me for more tips from a pharmacist.